Hello, I am Joanne Francis of Daily Skin Solutions. I have been a medical esthetician for over 35 years. I bring you the knowledge on causes and how to correct and prevent skin issues. Today's topic is melasma. Let's get started. Melasma. What is melasma? Melasma is a common skin condition and very frustrating. It appears as brown spots on the face. It affects all skin types and most common in women. So, what causes melasma? Melasma is considered a hormonal condition, such as from pregnancy, birth control, hormonal changes like perimenopause and menopause, even stress. Stress causes the body to make more of the hormone cortisol. An increase in cortisol may trigger melasma. So where does melasma come from? In the skin, we have cells called melanocytes. These are the cells that produce our melanin, our color, like a tan, for example. The job of a melanocyte is to protect us. That is why the skin gets darker if they are triggered and stimulated by the following: UV radiation, the sun, tanning beds and sun lamps, heat, such as hot days, saunas, and steam rooms. Excess oil, because excess oil also causes inflammation, which can trigger melasma, and trauma or injury to the skin. That can stimulate melanocytes and will worsen melasma. I will talk about that in a moment. I am going to go over how to treat melasma, but first I want to tell you what to avoid as a treatment to start with: lasers, intense pulse light, microneedling, microdermabrasion, and peels, without first conditioning the skin for at least one full cell cycle, which is 6 weeks. Because remember when I talked about trauma or injury to the skin? A melanocyte cell will overproduce to protect the skin from the trauma or injury of these treatments. Lasers and IPL, stands for intense pulse light, are heat-induced treatments. Microneedling and microdermabrasion and peels are a trauma to the skin. That is how they get the skin to react in a wound-healing reaction. Now, these treatments are great for anti-aging, but they will react to a melanocyte to overproduce to protect the skin. The skin needs to be preconditioned for these treatments to be effective on melasma by suppressing the melanocyte. These treatments alone only temporarily treat the effect of melasma, but they do not stop its cause. Melanocyte cells are deep. These treatments only clean up surface pigment. They do not address the cause of melasma, so the melanocyte will continue to produce melasma. These treatments can be very costly. Kind of like a Ferris wheel, people so get tired of it, constantly chasing it. You want to control the behavior of the melanocyte to improve its appearance on the skin. The key? Treating melasma with consistency and safety. James, let everyone know they are welcomed to reach out to me for guidance for a free consultation. So getting back to how to treat melasma with consistency and safety. Being consistent with any skincare regimen is what will give results. Safety is following directions and longevity of the prescribed protocols. Depending on the severity of melasma, there are ways in treating it to be controlled and improved. Most times melasma is not curable, but manageable to help one live a happy life. So let's address how to control and manage melasma. There are 2 ways to approach melasma with skincare: with prescriptions, including hydroquinone and tretinoin. This protocol is the best approach for stubborn melasma. As a rule, you should stop using hydroquinone after 3 to 6 months of continuous use, or 3 cell cycles and a transition period. This is because prolonged continuous use of hydroquinone with no break can lead to an adverse reaction to the skin or effect such as acryonosis. Acryonosis is a rare disease characterized by a blue-black or gray-blue pigmentation in the skin. There should be a minimum of 2 to 3 months off of hydroquinone, Then the treatment regimen can be repeated to manage melasma. Tretinoin increases cell turnover, which allows the hydroquinone to penetrate deeper. A great combination. The second way of treating and managing melasma is with professional-grade products like our daily skin solutions. They have pharmaceutical-grade ingredients such as vitamin C, niacinamide, alpha-arbutin, and calming and hydrating ingredients to manage the anticipated reactions. Anticipated reactions such as peeling, redness, flaking, this is what causes the cell turnover to work the melasma pigment up and out. Never forget your SPF. Your sunscreen is recommended to be a mineral sunscreen, which is more recommended than a chemical sunscreen. This I will talk about the difference in a YouTube video when I talk about sunscreens. I hoped this helped shed the light on melasma.